Hi, I'm Dr. Theresa Ramsey, and I was unable to do my videos because I developed laryngitis last week. So this is the first one I'm doing, I think, since the middle of last week. But I wanted to give you an update now. So now Arizona total cases is 152. I believe the end of Friday was 102. So it went up by 50 cases and 2 deaths. The 2 deaths were men in their 50s, early 50s, but they had comorbid conditions that went along with them. And I forget what they were, perhaps diabetes or COPD or I don't remember, but it wasn't a standalone infection that was the cause of their death. But yes, they did die of the coronavirus, which is very sad to know that we're starting to see deaths now in our state. But I wanted to give you this comparison. So the CDC website said there's 33,563 cases with 420 deaths of the coronavirus 2020. That's 1.25%. 1.25% of all cases died. Now I'm going to compare it to the flu. October 2019 to March 2020, there were between 38 million and 54 million cases of the flu, influenza. There were between 23,000 and 59,000 deaths, which is between 0.4% and 0.16% deaths of the flu. So the deaths of the coronavirus have surpassed the deaths of the flu percentage-wise. So, we have to really respect the federal guidelines, the state guidelines of social isolation. What does that mean? We're getting closer with our families. We're playing board games. We're eating mac and cheese out of the pantry. We're doing the best we can. Everybody is. And, if we can just extend compassion, to each of us, knowing, that those who bought so much toilet paper must have needed it. Okay, we're going to find it. We can't live in a state of panic right now because it's only going to add to that. And I know that we've talked about this last week, but it seems to be even more important now as we're starting to see deaths. The cases are still increasing. And I'm not 100% sure, but I pray that I am right, that when the hot weather comes, the virus should lower in numbers. Like we should start seeing, instead of going up, we should see this start coming down. There is no guarantee with this type of a virus that has a different RNA messenger than human body does, unlike influenza A, which is the regular flu. So, and also, as we're heating up here, southern continents are going to be cooling. And so the virus can move like influenza. Influenza we see every year. And it would be horrible if we see this every year. But if we do get exposed and we don't die, we do develop immunity for it the next time, if it did not mutate. There's a lot of things about viruses that are interesting because they always want to find a way to survive. And so what we can do, like we've talked about, is we can protect ourselves by strengthening ourselves, by making sure we're getting rest. I know people are not getting their rest because they're stressed. And whatever we can do to settle down, drinking hot tea, turning off TVs, dimming the lights, reading books at night, making sure that we're staying hydrated with whatever type of water we can get. My family is stocked up on water. I hope many of you are. And I do believe this should start to get better as the weather gets warm. So let's not stay in a panic. Let's just think about strengthening ourselves and our loved ones as much as we possibly can at this time. And do know we're still here to serve you. I am seeing patients as normal, and patients have the option to call in for their appointments if they don't want to leave their homes. I don't want to mandate that because we're not letting known sick people into our office. And so far we've been successful. We may have to change that soon, but we're just going one day at a time. So thank you for listening and take care of yourselves. We're going to get through this together, one day at a time. Bye-bye.